So how do you manage, how do you actually investigate a patient of suspected heart failure? Somebody who has effort dyspnea or effort intolerance, you examine this patient after history, do an ECG, chest X-ray, do biochemistry, electrolytes, and hematocrits, and then two tests are helpful in finally diagnosing heart failure. That is echocardiography and natriuretic peptides, which are indirect marker of elevated filling pressures. Based upon these two tests, you can arrive at three probabilities. Low probability of heart failure when both of these are not suggestive, high probability when both of these are suggestive, and indeterminate when one of these is suggestive. And in indeterminate cases, you might have to do many more tests like invasive hemodynamics, coronary angiography, cardiac MR, scintigraphy, and so on and so forth. However, imaging plays a big role in not only diagnosing heart failure, but also phenotyping heart failure. Imaging tells you about structural characterization, functional characterization, hemodynamic characterization, and tissue characterization. The heart failure could occur because of deposition of something in tissue or a scar in tissue. Structural alteration could be simple left ventricular hypertrophy as a result of hypertension, and functional alteration, I said, elevated filling pressures could be the reason. So phenotypic oversimplification of this complex syndrome heart failure like this, that heart failure with reduced ejection fraction 1, where left ventricular ejection fraction less than 40%, that is the dominant variety of heart failure in India. Then the other variety, heart failure with preserved ejection fraction, where left ventricular ejection fraction 50% more. Studied in between is heart failure with mildly reduced ejection fraction, where ejection fraction between 41 and 49%, and heart failure with improved ejection fraction, where the ejection fraction improved by a number of 10 or more % on treatment, or finally the ejection fraction became more than 40% from a lower figure.